Broadcast is now starting. All attendees are in listen-only mode.
Hello, and thank you for your interest in learning more about the 2018 Robert Wood Johnson Foundation Culture of Health Prize. This Phase 1 application informational webinar is being recorded and will be made available in case you want to review the material later or even share the presentation with your community partners. My name is Carrie Carroll, and I'm coming to you from the University of Wisconsin Population Health Institute. Also presenting on this webinar will be Katie Weir with the Robert Wood Johnson Foundation. We'll be hearing from Katie in just a few minutes here. We'd like to start by acknowledging that the Robert Wood Johnson Foundation Culture of Health Prize is a collaboration between RWJF and the University of Wisconsin Population Health Institute. Many of you may know the UW Population Health Institute from our work and leadership on the county health rankings and roadmaps for the past decade. We're partnering together and with others to help build a culture of health across the country. Next, we want to take a moment to get you oriented to the technology we're using today. The GoToWebinar interface is made up of two main parts, the viewer window and the control panel. And if you're having challenges with the technology, just let us know via the control panel. You can click on that. And thanks to those of you who submitted questions when registering for this webinar. We hope to address your questions throughout the presentation, and know that you can type additional questions during the session, and my colleague Olivia Little will respond. And we'll also do our best to answer your questions later on in this hour-long session. We also wanted to let you know that the slides are available in the handouts section of your control panel, along with two very key documents. The 2018 call for applications. Hopefully you've already had a chance to look at that. And another document called the Frequently Asked Questions, or FAQs. This is extremely helpful for applicants, and these FAQs were built on actual questions that we've received from communities over the past few years. So we strongly encourage you to review both of these documents as you consider applying for this year's prize competition. So on the next screen, you'll see what will be covered during our time together. We'll start off with an overview of the Robert Wood Johnson Foundation vision to build a culture of health throughout the U.S. We'll cover the purpose of the prize and share a list of past winners so that you're aware of what communities have already won. We'll spend the bulk of our time together really talking about the application and selection process. And again, we'll have time for your questions. So now I'll turn it over to Katie Weir to tell us more about Robert Wood Johnson Foundation. Katie?
Thanks, Carrie. It's a pleasure to be with you all today. And I wanted to start by sharing more about what our vision is, to help contextualize the prize for you all. So as the next slide will say, that our vision is one where we as a nation all strive together to build a national culture of health. That's a culture that enables all of us in our diverse society to lead healthier lives now and for generations to come. And as you can tell on this next slide, that for us, this culture of health really recognizes that health and well-being are greatly influenced by where we live, how we work, the safety of our surroundings, and the strong connections we have with our families and communities. And so in order to build a culture of health, this country needs new leaders and partners and community members from across disciplines and sectors to come together to think of health and think of change in new ways. And we know that there are communities that are already bringing this great work to life. And that's exactly why we created this prize. The RWJF Culture of Health Prize honors communities that demonstrate outstanding examples of the Foundation's vision in action. There is no one way to build a culture of health, and the communities are going to approach it differently. The prize program celebrates, elevates, and learns from communities that have placed a priority on health and are creating powerful partnerships and deep commitments that will enable everyone, especially those facing the greatest barriers to good health, to have the opportunity to live well. Prize communities are pursuing proven strategies, innovative ideas, and leveraging their unique strengths and measuring and sharing results. Prize communities show that what's possible when health is at the heart of decision-making. The prize also recognizes all types of places, whether they're cities or counties, tribes, small rural towns, or interconnected regions, no matter what their physical, economic, or demographic challenges may be. Communities that are committed to not only providing access to good quality care, but also to providing opportunities for better health by transforming neighborhoods, schools, businesses, and so much more, so that better health flourishes everywhere and for everyone. We've also heard from past applicants that the process of applying can be a really great learning experience for their community. Applicants often report that they benefit from the process by bringing partners together, reflecting on what the community has accomplished, and using the prize criteria to identify strengths and opportunities. As this quote is shared from one applicant, notes that this introspection really involved in writing the application served as a significant motivator for us. When we saw on paper how much we actually accomplished, it invigorated us to forge forward. It's important to emphasize that this prize is a prize, not a grant. It's an award to recognize that communities for what they've already accomplished on their journey to build a culture of health. Therefore, communities can use the $25,000 in any way they choose to enhance their work, and budget reports to us at the Robert Wood Johnson Foundation are not required. The value of the prize goes far beyond the dollar amount. It is a designation as an honor and an opportunity to recognize and elevate the work being accomplished in communities across the nation. Prize winners have their stories and successes celebrated broadly to inspire others toward locally driven change. They connect with other national and community leaders as ambassadors for building a culture of health and are provided with video communications and other supports along the way. And they get to become part of a national network to engage and learn from other prize winners and to network locally, regionally, and nationally. So while the work will continue within your own communities, there is a deep desire from other communities around the nation to hear about and learn from where you are and what you are doing. So for us, it is an opportunity to connect with you and with each other and with peers in other communities to foster that spirit of networking and learning. We're now excited to say that we have 35 communities designated as Robert Wood Johnson Foundation Culture of Health Prize winners. Congratulations to the 8 2017 winning communities, which were just announced yesterday on September 19th. The 2017 winners are represented by the orange markers on this map here, and past winners are shown in blue. You can see our winners span 23 states, including 5 tribes, and represent communities of many different sizes and geographic characteristics. We have received several questions about whether there's a population size minimum or maximum to apply for the prize, and whether the prize applies to rural as well as urban places. As you can see from looking at the winners, we've had competitive applications from communities that span a full range of population sizes, both rural and urban communities, and everything in between. So with all that said about the context of the prize, let me turn it back to you, Carrie, to go into the actual application process.
Thank you, Katie. We encourage you to visit the Winners Gallery at rwjf.org/prize. Here you can read about all of the winning communities that Katie just mentioned and view inspiring videos and start the application process for 2018. And again, you'll find the call for applications and the frequently asked questions documents on rwjf.org/prize. In a few minutes, we'll share a few screenshots to tell you more about precisely where to find these documents. So I'm sure all of this has whet your appetite for learning more about what you can do to bring your community to the forefront as a potential RWJF Culture of Health Prize winner. Here's a brief overview of the selection or application process, and then we'll dig into the criteria by which the communities are judged. The prize application process has 3 phases. The first phase, which is where we are right now, consists mainly of a 5-page essay that introduces reviewers to your community and your key accomplishments. One question we get asked. Often people want to know how many applications we typically receive for this phase 1 of the prize competition. And submissions have ranged in the past really from 200 to 350 per year. So perhaps that's helpful. So after reviewing the phase 1 applications, we'll invite up to 50 communities to proceed to phase 2. And then after reviewing those phase 2 applications, we'll select up to 16 finalists who will receive site visits. And then following site visits, up to 10 communities will be selected to win the RWJF Culture of Health Prize in 2018. So we know you already have your calendars marked for Friday, November 3rd. This is the deadline, and please note the time of this deadline. It is 3 p.m. Eastern Time. This is an absolute deadline. There are no exceptions made, and it does include no exceptions for internet connectivity issues or any confusion about time zones. So on the next slide, you'll see the overall timeline for the prize competition. And there really are 2 key dates I want to highlight at this time. The phase 1 applicants will hear from the team on December 8th as to whether or not they've been invited to submit the phase 2 application. And then the other date I wanted to call out is January 18th. That's for those that advance to phase 2. And that's when the phase 2 applications are due. So we like to outline that full timeline for you at this stage. So one of the biggest questions we get asked is, who is eligible to apply for the prize? This prize award may be different from other prizes in that it's based on geographic jurisdiction. So this is not a prize for a particular organization or a particular accomplishment. The prize award reflects the work across the whole geography of your community. To be eligible for the prize, you must present an application that reflects the work of one of these: a city, town, village, borough, or other municipality with a publicly elected governing body, or a county or parish, or a federally recognized tribe or a state designated Indian reservation, a Native Hawaiian organization serving and representing the interests of Native Hawaiians in Hawaii. This is a customized definition for Hawaii only. Or a region which would be a contiguous towns, cities, boroughs, or counties that work together in an integrated way. So we'll also note that communities with within U.S. territories are also welcome to apply. So one thing you'll clearly see is that that neighborhoods are not on this list. And we understand that in larger cities, it may be challenging to represent a whole city in an application. However, we just can't look at neighborhoods alone. So it's perfectly acceptable within the context of a city or county-wide application to feature the good work of a neighborhood, but please do so in the context of the broader efforts that are taking place within that town or city or county. So as we've said, the prize honors the work of a whole community in the U.S. And organizations or coalitions often take the lead in preparing the application. However, and we know that someone who has to be that author, has to be that leader, that convener, but please remember whole communities. To be competitive, it's imperative that prize applicants keep a community-wide focus in mind as they're applying and moving through the application process. We often do receive other questions pertaining to eligibility. One question we received is, what's the most common mistake that voids entries? And this really is part of the reason why I'm emphasizing this notion of whole communities, because it is one of the most common mistakes. In other words, perhaps a single organization submits an application, and that does not reflect the whole community perspective. It's more of the work of a single organization or a single program. Another question we get is, can communities located in the same state as previous prize winners apply? And the answer to that is yes. Each community application is judged individually and not in relation to other applicants or other winners in similar geographic areas. I also want to be clear that past applicants may apply again. Exceptions to this are past prize-winning communities and communities that were designated as finalists in 2017. We ask that year sit out one round before they apply again. And a list of past finalist communities can be found in the prize FAQs document. So just in summary, if your community did not receive a site visit last year and your community is not already a prize winner, then you are welcome to apply for 2018. All right, so now we're going to turn to the criteria by which all prize applications are judged. The most important element in how we select communities as RWJF Culture of Health Prize winners is how your community performs across the 6 criteria. So Katie and I are going to discuss each criterion, and this really clearly is the heart and most important part of this presentation today. And before I start, I'll just say that one other question we get is around how the criteria are weighted during the selection process. And we want to say that there is no formal weighting of the 6 criteria. We look for communities that are able to address all of the criteria across the board and in a holistic way. So that said, in phase 1 applications, we do pay more attention to the first 3 criteria, which we consider foundational to building a culture of health. So let me get started. The first criterion is defining health in the broadest possible terms. Building a culture of health means we use diverse strategies and address multiple factors that influence health. This really is built around the county health rankings picture of health that you'll see on the next screen. When we talk about defining health in the broadest possible way, we're thinking about all of the health factors, those that you see in the blue boxes on the right. These ultimately drive how long and how well people live. So we're looking to understand how your community is bringing this model to life in ways that demonstrate your community's needs, assets, and priorities. And we're looking for you to describe how you're taking action across these areas. In particular, and given the importance of the social and economic factors in the model, we want to see examples of how your community is taking specific action to address these factors. So some examples might be how you're improving high school graduation rates or how you're increasing access to early childhood education. We're looking for how your community is addressing health from a very broad point of view. We often get asked, what makes a successful application? Or what are some of the reasons applicants are not chosen to advance through the process? Applications that focus entirely on on clinical care or health behaviors will not be competitive in the prize competition. This is one of the most common reasons that phase 1 applicants do not move forward. And while work within these factors is highly valued, judges are looking for applicants and applications that exemplify a balanced portfolio of activities across the health factors and that are clearly addressing the social and economic factors that improve health. So Katie, let me turn to you to walk us through criterion number 2.
Thanks, Carrie. So our second criterion is committing to sustainable systems changes and policy-oriented long-term solutions. For us, this is making thoughtful, deliberate, and data-informed choices on policy, programmatic, environmental, and systems changes that are designed to last. That is, changes that don't go away as the grant ends or the program ends. We really encourage applicants to demonstrate how residents, leaders, and organizations across different sectors are collectively identifying priorities and taking coordinated action to implement these sustainable solutions to health challenges that a community might be facing. We know that no health issue can be solved with a silver bullet, so we are looking for how communities are pulling together strategies that go beyond programs and services, to thinking about making lasting changes to policies, systems, and environments, sometimes at the level of government, but could also be at the organizational level, for example, within businesses, workplaces, and schools. As one of our prize winners stated so aptly, you're not going to affect change that really does not, excuse me, let me start this quote over, since it's so powerful. You're not going to affect change that really does move the needle on health of the community without policy change. We received a question asking for examples of policy systems and environmental changes that communities have undertaken. There are many, so here are just a few examples, by no means meant to limit you in your community. Some of these examples may be passing tobacco control policies or food ordinances, housing and construction policies, physical environment improvements such as sidewalks and trail systems, and education and job policies that promote growth and economic security. So let me turn it to you, Carrie, for the third criterion.
All right. The third criterion is about creating conditions that give everyone a fair and just opportunity to reach their best possible health. To those of you that are more familiar with the prize criteria perhaps from previous years, you may notice we have refined this language for criterion number 3. And what we've done is really incorporated what communities are sharing with us about the crucial elements necessary to guide effective action. So this criterion is about intentionally working to identify, reduce, and ultimately eliminate disparities in health, and in partnership with those most affected by poor health outcomes. This includes cultivating a shared commitment to equity across the community, valuing diverse perspectives, and demonstrating how you're working to foster a community where all residents feel a sense of security, belonging, and trust. Next slide, please. We're looking for efforts that go beyond just targeting programs and services to those We're looking for efforts that go beyond targeting programs and services to those experiencing negative health outcomes, to really authentically engaging community members to create change. So this means engaging diverse perspectives in collective problem solving and truly valuing the voices of residents at all levels of the community. We really want to hear about the full participation of those excluded or marginalized groups and those most affected by poor health, especially how they're engaged in making decisions and driving solutions. So a true and rich engagement of all people in the community to create and implement solutions that will improve health. And when you look at the prize stories of past prize-winning communities, you'll learn about some great examples. There's some examples about how communities are doing community organizing, how they're mobilizing youth and student leaders and engaging community residents around addressing violence and revitalizing neighborhoods and improving education. So again, these are just a few examples of areas that have stood out in past prize-winning communities and certainly not meant to be limiting of the successes and strategies you're using in your community. So back to Katie.
As Carrie mentioned, the first 3 criteria are the main focus of the Phase 1 application. But to keep in mind, we are also looking for standout work in the next 3 criteria, and more information will be gathered about these criteria as applicants move on in the Phase 2 of the competition. Criterion 4 is about harnessing the collective power of leaders, partners, and community members. It builds on the notion of engaging the community and goes beyond that to recognize that building a culture of health means that we are all in this together and we are all working to provide everyone with the opportunity for better health. We encourage communities to demonstrate how those robust and diverse partnerships, such as business, government, residents, nonprofit organizations, faith-based institutions, and more, are developing the methods and infrastructure for shared buy-in, decision-making, coordinated action, and accountability. That's really, in some ways, how community leaders are getting out of their traditional silos, if you will, and collaborating with other sectors, especially with those that don't usually consider or are considered, quote, health partners, such as the business community or community developers or educators or law enforcement. And as a real commitment to developing leadership skills and capacity among all community members, including the notion that leadership should go beyond those that have positional power. So thinking about leadership coming from different parts of the community and fostering that type of collective action and authentic civic engagement. Another thing I would reemphasize here is that we are not interested in seeing applications from single organizations. We know there are a lot of dynamic organizations doing a lot of great work in this country, and this prize is not the opportunity to highlight that, but to showcase how multiple organizations, agencies, partners, and residents within a community are coming together to drive change. So back to you, Carrie, to talk about the fifth criteria.
Excellent. This one is about securing and making the most of available resources. So this means thinking with a real enterprising spirit. We want communities to consider how they're critically examining existing and potential resources and fully leveraging their existing assets. Writing a successful prize application really requires that you and your partners take stock of what you have in your community and how you're using what you have to the best of your ability to produce the best value for community health. We also want to hear about resources in a very broad sense. So how you're deploying your people, your financial resources, your natural resources. We'd like to hear about how your community is making upstream investments to prevent poor health outcomes, and how you're creatively approaching the generation, the allocation, the alignment, the mobilization of, again, both financial and non-financial resources to really evolve and sustain your health improvement efforts. And just a bit more on sustainability. This really is a key piece here. And this really is partly why we're not interested in hearing about how many grants you've been able to secure for your community, but instead how, when you've received a grant, how did you fully integrate those resources into your community's work, and how have you been able to sustain that work beyond the completion of the grant period? All right, back to Katie for our sixth criterion.
Thanks, Carrie. So this is our last, but certainly not least criterion, measuring and sharing progress and results. For us, building a culture of health means thinking and working with a destination in mind. It means having a commitment to measuring the quality and impact of these coordinated efforts, both how the work is done and what the impact that's been achieved. This involves several elements, such as establishing shared goals across sectors and partners, including agreeing on shared definitions of success and addressing health disparities. It means identifying measurable indicators of progress and continually using data to improve processes, track outcomes, and change course when necessary. We want to see how communities are developing these systems for collecting and sharing information, determining impacts across these efforts, and how they're communicating and celebrating successes when goals are achieved. Registrants have asked us several questions about what types of data and outcome measures should be submitted in an application. In phase one, you may want to start by focusing on your data goals, the identified priorities and success measures your community has identified, and what you are doing to collect data and measure outcomes. You can certainly highlight both quantitative and qualitative data that speak to your goals, but in phase one, given the space limitations, you may want to focus on a few pearls of outcome measures if you have them. The second phase application will provide more opportunity to report outcomes in depth. So now back to you, Carrie, to go into the specifics for how to apply.
All right. As I mentioned earlier, everything you need to apply is available at rwjf.org/prize. So when you go to the home page, you'll see the call for applications, and you can click on Learn how to apply to get more information about the application process. So on this page, you can find the prize criteria and the links to key materials. There's even a sample application, which may be helpful to view right away. The funding opportunity brochure link is really the same thing as the call for applications. So you'll be able to download that as a PDF, and you'll also note that we have that document available in Spanish. We really do encourage you, I'll say it once again, to review the FAQ document, the frequently asked questions document. These are questions that we've collected from past applicants and are really helpful in better understanding the eligibility, the application and selection processes. And when you're ready to start putting your application together, you can click on the Apply Online button, which will take you to the My RWJF portal. So My RWJF is where you'll work on your application. And if you've ever applied to RWJF before, you can re-enter your email address and password. There's a place to click if you've forgotten your password, and they'll supply it to you. And if this is the first time you're applying to the foundation, you will need to register. Just click on that register button and it'll take you right through the process. So it might also be helpful to know that you don't need to complete your entire application in one sitting. You can always save your entry data, exit the portal, and then return later to continue working. And there's also an auto save feature coming soon, so you don't need to worry about saving your entry data. So when you get into the My RWJF system, it's going to have a number of different screens that will ask for different information, and we're going to walk through that information now. If you've applied in the past, you'll find that the application process is pretty consistent with previous years. And you'll note that once you've registered, you can download the instructions for applicant communities. This is in the reference or resources section on the left-hand side of the application homepage in My RWJF. So this provides some very detailed instructions about what I'm going to overview right now. And please note that the RWJF, My RWJF is currently in the process of updating its system. So after September 25th, it might look a little bit differently from today, but all in all, most things should be in the same place. So when you go in, you'll first be asked for some key demographic information about your community, and you'll also be asked for 2 key contacts. So we really hope that you'll preferably have 2 different organizations as those key contacts to really speak to how you're partnering. These 2 people will be the key folks we'll be communicating with regularly about the status of your application, and they're key contacts for staff here at RWJF and the Population Health Institute. And as I mentioned earlier, the Phase 1 application really is largely a 5-page essay. And the essay consists of 2 main parts. So first, you'll be describing your community, and then you'll describe your community's work by highlighting 4 accomplishments. For the essay, in the first page, we'll ask you to introduce your community and tell us more about the key physical, social, economic characteristics of your community. We'll ask you to think about including some important historical and cultural considerations about your community, and then also tell us a bit about who's most affected by poor health. Another opportunity to include is how your community's health improvement journey began and what catalyzed collective action. That's really helpful for us to hear about. We really want to understand your community story. We want to understand your assets, your pressing needs, and how you got started on this journey to better health. So really try to introduce yourselves in a compelling way and make your community come alive to us. So a bit more about the 4 accomplishments. In the essay, we're asking you to choose specific policies, programs, or strategies that you've deployed to best respond to identified needs. And we ask you to help to provide these accomplishments to help show us how you're making progress toward better health. Communities often ask us how to choose from just 4. You've got so much great work going on across your community, and there's no one answer to this question, but we encourage you to think about what 4 accomplishments really best reflect the 6 prize criteria that Katie and I just stepped through. And we do know how challenging it can be to narrow it down to 4, but ask you again to consider the criteria and what accomplishments together reflect all 6. So a bit more about the accomplishments themselves. They can be relatively new or well-established policies, programs, or strategies. Applicants often ask whether an accomplishment needs to be a specific strategy or whether it can be a group of strategies. And the answer is yes, it can be either. Some accomplishments may focus on a particular policy or program, while others may describe a suite of activities that you're doing to address a pressing need. Accomplishments may not be planning or convening processes, or even the development of a coalition or a particular project. They may not be your community health assessment or your community health improvement plan. We certainly recognize the importance of creating these coalitions and bringing people together and doing this kind of planning, but we really see them as the predecessors for your accomplishments. They are the foundation on which you build your accomplishments. So you may choose to mention these kinds of things, particularly in your introduction, but as far as the 4 accomplishments you choose to feature, we really want to know what actually happened as a result of that coalition coming together, for example, or as a result of that community assessment plan being developed. One other thing that people ask is about why their application did not move forward in the process. And so this really is another common reason. That the applicant did not have 4 accomplishments that meet this criteria around accomplishments, and the community included the development of a coalition or community health needs assessment as one of the accomplishments. So I can't stress that enough. Accomplishments really need to be about action moving forward. So after you've completed your essay, we'll have a short worksheet. It's pretty simple. It's kind of an abstract of the information you've given us so far. We'll ask you to simply provide an accomplishment name, a brief description, and a note to which of the health factors from the County Health Rankings Picture of Health each accomplishment really addresses, and then an approximate year that accomplishment began in your community. So again, this is just a brief summary workshop that's really helpful to the judges. As I mentioned, you will be asked to describe your community and the 4 accomplishments in a way that helps reviewers see how you're living out the 6 price criteria. And in the first phase, we'll certainly be looking at all 6 of those, but honing in on the first 3 criteria to decide which applications will move to phase 2. So we really do want to be transparent at this stage of the competition that reviewers are paying particular attention to those first 3. And again, those are defining health in the broadest possible terms, committing to sustainable systems changes and policy-oriented solutions, and creating conditions that give everyone a fair and just opportunity to reach their best possible health. And a note about who the reviewers are. Phase 1 reviewers are staff from the the UW Population Health Institute and the Robert Wood Johnson Foundation. As I mentioned earlier, up to 50 applications will be advanced to phase 2. And for those of you who are invited to move on to this phase, there'll be opportunity to further expound on the work of your community and accomplishments. There's also a brief video that provides judges with a chance to hear directly from your community. And we often do receive questions about this video component. So please know if that you are invited to advance to phase 2, you'll receive much more detailed information about this. And in the FAQs, there's actually some links to some ideas for easy free software that you can use to produce videos. So I might also mention that the videos that you see on the rwjf.org/prize website are those that are very highly professionally done after winners are selected. Those are not the work of the communities themselves. The last thing I'll mention on phase 2 is that there's a draft site visit itinerary. And this is where, this is a tool to let judges better understand if they were to visit your community, what might they see and who might they meet. So again, these are pieces of information only for those that do advance to phase 2, but we like to lay out the whole expectations, and so you can best make decisions about applying for the 2018 prize competition. One more note about past applicants. We've been asked if there's any advantage or disadvantage for those that have applied in the past to reapply. And again, we want to encourage you to think about the criteria and think about the process. And if you're a past applicant and feel you've made progress and can answer the criteria better than you did last time, we welcome your application. We absolutely know this is a continuous journey, and we love hearing about the progression of that journey in your community since you last applied. And so there's really no disadvantage to reapplying, provided you submit an updated application that shows progress. The last phase is the site visit phase, and this is where we give life and voice to phase 1 and 2. So again, up to 16 communities will be asked to move forward as finalists in the site visit phase. And what happens is typically 5 visitors from RWJF, from the University of Wisconsin, and from our panel of national experts will visit the community and spend about 24 hours there. They take a tour of the community, they have in-depth conversations with leaders and community members. And we also want to mention that the finalist stage, in other words, those that are advancing to the site visit phase, is a public recognition. And so there is a news release when that, and that information is circulated widely. So again, can any community win? Any community that meets our eligibility criteria can compete for the prize, and all communities can take a broad approach to becoming healthier. So as you'll see in the past winners, there are large places, small places, tribal nations, urban, rural. This process really is about helping us understand how you're working to create a healthier place to live, learn, work, and play, and within the context of your community and through the lens of the 6 prize criteria. Another question we often get is, what makes a successful application? Or in other words, what sets winners apart? And there really is no one answer. We're looking for unique approaches. We're looking for you to tell your community's individual story and how you're bringing the criteria to life. Others have asked about specific examples of communities building a culture of health. And for this, we do encourage you to visit rwjf.org/prize and look at those videos and really spend time with the stories of the 35 winners. There's a lot to learn there, and we are certainly not asking you to be a cookie cutter replication of what you're seeing. There's a wide range of work being done, and winning communities are bringing people together to address unique needs, and all of the different types of communities that can become prize winners. So we are now going to turn to questions and answers, and we'll keep the screen up as we go to this phase of today's webinar. You can see links here to information that we've talked about, key documents. We also wanted to mention the handouts are in the control panel if you haven't had a chance to get those. We'll also post this recording in myrwjf.org for future viewing. You can see on this slide our contact information. So I know Olivia and I really stand ready and willing to answer your questions and be of assistance to you as you move through the application process. So at this point, I'm going to ask Olivia Little to chime in here. She's been fielding questions from the audience. And Olivia, do you have any questions for us? You might be on mute.
Sorry, I was on mute. Hi, everyone. Can you hear me?
Yes.
Great. So we've got a few different questions coming in. And I'm going to start with a question that we've gotten from a few different places in the registration question. I think it relates to another question that's just come up. And that is questions about whether the prize applies to rural communities as much as to urban, and whether we consider different aspects of diversity beyond just racial and ethnic diversity. Carrie, do you want to start on that one?
Sure, that's a great question, and the answer is absolutely yes. We want to hear how your community is building a culture of health within your own unique context. So how are you, as we mentioned, how are you addressing the needs in your community, particularly of those that are least likely to access opportunities? We really do want to hear your own unique stories and circumstances. We want to hear about the disparities that may be in your community and how you're working together to address them. And I really do think there's a lot of great examples from past prize winners that show a breadth of communities that have very different demographics and economic circumstances, and including the winners that Katie mentioned that were just announced, really do illustrate this diversity beyond racial and ethnic diversity. I'll invite Katie, Olivia, is there anything you'd like to add?
This is Katie, and the only thing that I would add, because I think it's sometimes also tied to this question, is whether or not there's one right way to be a prize winner, and the answer is no, that we see a culture of health as taking many forms and shapes, and that there's no one right path to achieving a culture of health.
Thanks.
Thanks, Katie.
Thanks, Katie. I'd like to add to that question another question that we've gotten in the question box, talking a little bit more about how communities without access to large or reliable sources of funding might demonstrate the same type of progress that you're seeing in other communities. So in other words, are communities being compared with one another when applications are assessed? Are we taking into account communities that have different capacities and different levels of funding and resources, and those that historically might have less access to resources?
This is Carrie. I'll start, and then I'll ask Katie and Olivia to add, but certainly again, the 6 prize criteria are the bedrock of how we view communities and applications. And so we do not compare communities with resources, or, you know, there's different types of resources that they're drawing upon. So we absolutely throughout the process refer back to those foundational criteria. Katie?
Just to build on what you said, Carrie, and I appreciate underscoring that the criteria are the set of ways that we judge communities, and recognizing that it is not against other communities, but really against the criteria. And again, I would just reemphasize that we recognize that communities of all kinds are going to be able to bring these criteria to life in different ways. And so it's, in our mindset, it's a recognition that we are wanting to showcase the assets of communities and how they're able to leverage different kinds of resources, whether that's human power or financial resources or natural resources or other kinds of resources within a community, in order to bring this broad definition of health to life, and keeping the opportunity for all people at the center of the work that they do.
Yeah, and I would just underscore that we're asking communities to describe what you're starting with and what you have and how you're using the natural assets and strengths already in the community. So that frame as well. I've received a few questions regarding sort of who can lead, who can lead the application. Can an MPO lead? Can a tribal nation be the direct recipient of the prize? And I'm happy to clarify some of that. So any organization can serve as one of the contacts for your application. Remember, the application is on behalf of the whole community. But any organization can be that convener and take the lead in filling out the application and being the contact. That can be a community-based organization, or really there's a whole range of different sectors: community development, education. It can be a government agency. It can be any type of organization. We just underscore that the application content is about the community as a whole. And the cash award of the prize can go to any community-based organization or government agency that the community designates as the recipient. So I just wanted to clarify that. Another question, a couple of questions about another question that we just got in is, while we are making progress in many areas, our county health rankings are low for the state, and will that disqualify us? You want to take a shot at that?
That is a great question that we have heard before. And the county health rankings, for those of you who haven't explored that tremendous resource on countyhealthrankings.org, is really meant to be a call to action. So it provides data across various health sectors, over 30, and provides rankings on for your community, your county, and your state. So we have certainly heard many examples of how communities are using the county health rankings to really spur conversation and monitor progress within particular health factors. We do not take into account the overall ranking of any county within their state. And certainly, again, the prize criteria are what we look to really see how your community is moving forward. So we do not take into account your ranking, period. Katie, would you like to add to that?
Thanks, Carrie. The only thing that I would add is that we recognize that communities are on a journey, and this prize is a way to elevate that journey. So you'll see in even some of the previous prize winners that they're not always the rank the highest, for instance, in their community, nor do they have always the best health outcomes or other kinds of outcomes. It's really, to Carrie's point, how they're living out those criteria and what that means for the kinds of progress that they are making as they move forward, and their commitment to continuous improvement along the way.
Thank you. Another common question that we get is, what constitutes readiness to apply for this award?
That is a great question. So there's no one indicator of readiness for this application to win this prize. We have heard from communities that they use the application and the criteria to have conversations with their key partners. And some folks have said they don't know who to have that conversation with. So we really feel this is the first stage of readiness, that there is a set of natural partners who are coming together to have these types of conversations. So, you might look around to see, where are these partners that are working regularly together, and how might they reflect together on the body of the work happening in your community. And I might mention again County Health Rankings, and perhaps Olivia can chat out a link to this one. There's a Poised for Progress tool. So this tool asks a lot of questions about how a community is ready to take action. It's a self-assessment is what it is, and it really helps you determine where you are in your journey toward building a culture of health. So again, the criteria are key, and having those natural partners that are logical to work together on an application. We like to say this isn't about one person writing an application in their office. This is very much about the community telling your story together.
Thanks, Carrie. I'm looking through all of the questions coming in.
Time for a couple more, I think.
Yeah, and please know there's several here. So if we don't get to your question here, please email us at the email address on the screen, and I will try to respond to some of these as well in the chat box. So here's a question. Criteria 1 explains that action should include all the factors in the County Health Rankings model, and for the essay mentioned that the accomplishments can relate to individual strategies. So I think they're asking for a little more explanation about covering all of those health factors within 4 accomplishments.
Excuse me, I was on mute. This is Carrie. I'll start real quickly. We did not mean to imply that you need to address all of the county health rankings, those health factors across the entire model of health. What we do want to see a breadth of the work, and that you're approaching health broadly. Katie, Olivia, do you want to say more? Maybe.
Sure. I think one of the things we're trying to underscore is that we want to see a range of accomplishment that touches on multiple factors across that model, and that the accomplishments, those 4 accomplishments, can be, sometimes they're about sort of one program or initiative, sometimes they are a collection of strategies to address a problem, and that is one way that applications sort of show how they are touching on all of those different strategies.
I hope that's helpful. And I know we are at time. Again, our names are on the screen. If you have questions, burning questions as you think about applying and as you get into the application process, please contact contact one of us. In closing, I really want to thank Katie Weir and Olivia Little for your help with today's webinar. And I want to share this wonderful quote from a leader with the Shoalwater Bay Indian tribe. It really captures the spirit and the intent of the prize competition. She said, "We often forget to stop, smell the roses, and reflect on our endeavors, and the prize experience has allowed us to do just that." So it's really our hope that regardless of whether or not your community feels ready to apply for the 2018 Culture of Health Prize, that you and your partners consider and take to heart the 6 prize criteria as you continue your health improvement journey for all of your neighbors. And we thank you for listening to this session and for your great contributions made each and every day to building a culture of health across our great country. Take care.